Hello, my name is Professor Mark Taubert. I'm a palliative care consultant here at Velindre Cancer Centre. I work in palliative medicine, a specialty that deals with people who've got an advanced illness and who are sometimes approaching the end of their lives. But we often get involved from diagnosis onward, and what we try and do is help people with symptoms, symptom management, pain, nausea, vomiting, sickness. It's a job I've been doing for the last 20 years or so.
Hi everyone, my name is Dr. Ahmed Essa. I'm a medical oncologist working in Velindre Cancer Center. I've been working here for the past couple of years, supporting teams providing specialist cancer services. I've been working with multiple teams. I've worked with the breast team, colorectal team, lung team, and renal team as well.
Hello, I'm Dr. Sarah Walters. I'm a consultant clinical oncologist and I treat lung cancers. A large part of my time is seeing patients, usually in the outpatients or upstairs in our ward if they've been admitted unwell. Another large proportion of my job is radiotherapy and managing all the complex pathways associated with both chemotherapy and radiotherapy.
I'm Dr. George Joseph, consultant radiologist at the Velindre Cancer Center. We do all types of imaging of the patient's body here. We have CT scan, MRI scan, fluoroscopy, plain X-rays, as well as a nuclear medicine department where we do bone scans and heart scans. We help the clinicians reach an exact diagnosis for their patients, and also we image the patient's disease such that we are able to inform the clinicians and the patients how the disease process is going, especially in regards to the effect of treatment.
What brought me to Velindre was doing a placement with Professor Elora Finley and the palliative care department here while I was working as a junior doctor. I joined one of their ward rounds and was immediately taken by the atmosphere here at Velindre as a cancer centre, and how fantastically run the place is and how many different aspects of good medical practice go on here.
I originally came to Velindre as part of my training, so I'm really proud that actually I've done most of my training here in South Wales, and it's a place that I think really embodies the ethos of caring, as it says on the door, Hospital of Hope, and this is a place where I wanted to continue working as a doctor.
I've always felt that working in cancer care is extremely rewarding, to be honest. It's always a great privilege to be able to help another human being at a vulnerable time of their lives. I think we celebrate National Doctors Day. When this day come along, I think about the day when I decided to go into medical school and become a doctor. So it's a Doctor's Day, but I always think about how grateful I am to all those people who made it possible for us as doctors to provide quality care to our patients, and that would go for our nurses, pharmacists, administrators, and hundreds of support workers who are working hand in hand with our patients.
So on National Doctors Day, I think it's really important that we look at all the different areas that we work in as doctors, general practitioners, palliative medicine, oncology, general medicine, and that we sort of celebrate that a little bit, our diversity, what brings us together. It's not an easy job, but it brings so much satisfaction, and I can heartily recommend being a doctor.